episode number 16 of the Thank Gut It's Fixed show is going to be about small intestinal bacterial overgrowth, also known as Sibo intestinal overgrowth. Now, before I go into the details and all of that, what to do about it, let me tell you what it feels to have Sibo, so that maybe you have it, or maybe someone else that you know has it, and so that you can kind of think before I keep going. So with Sibo is that the symptoms are similar to irritable bowel syndrome. Irritable bowel is one of those big umbrella conditions that they do some testing, they run some labs, everything's fine, maybe they do a colonoscopy or endoscopy, everything's fine, and they tell you you have IBS, irritable bowel syndrome. And I know some of you out there are Arabic speakers, so qulun al-asabi, if you've heard of it being diagnosed this way. So irritable bowel syndrome. Now, it's been found that up to 60 to 80, let me have my notes here, 60 to 80% of people who have or been diagnosed with IBS actually have Sibo. So what with Sibo is, now we're starting to have a root cause. Now we know that your symptoms, the diarrhea, the constipation, the bloating, the stomach pain, the gas, the heartburn, now we have we're starting to the beginning of catching the cause or a trigger for it, or an actual diagnosis, which is Sibo. And that offers relief, because now that you have it, you could actually do something about it. Now, Sibo is not an easy condition. It is one of those things that might need multiple, few months to get to resolve. It does come back for many people, but at least you can start to get relief instead of living with your IBS without any answers or any solutions. Now, Sibo, what does it feel like to have Sibo? As I said, you may have bloating, you may have stomach pain, you may have gas, you may have burping or belching, you may feel really full after eating even a small amount of food, and you're wondering like how come or why am I feeling too full very quickly? If you are here with me live and joining, if you have any of those symptoms, or if you know someone that does, it doesn't have to be you, so make it a little bit, not personal, but if you know someone who has these symptoms, maybe, write us and tell me, like, is this can be Sibo, or, let me know how are you feeling, or why do you suspect that this might be you, or something that is happening for you. Some of the symptoms with Sibo, so if you burp a lot and you're not sure why, if you have indigestion, food sits in the stomach, typically in the upper part of the stomach, right under the rib cage, and it's just like not moving. If you have heartburn, and I said acid reflux, nausea, like you're just you're not feeling good, you want to vomit, or you vomit from the food, that could be Sibo related. Now, other than digestive issues, so often we think of digestive issues, but some of the symptoms may be having headaches or migraines, having food sensitivities, fatigue, because I'll tell you why, because Sibo can actually lead to nutrient deficiencies. It can cause joint pain. So actually Sibo can trigger food sensitivities, and all of those things are symptoms of food sensitivities. Depression, mood swings, as well to nutrient deficiencies, fatty stool, which is when your poop kind of floats in the toilet and has a bad smell to it. That can be a sign that your body's not digesting things properly, because you have an overgrowth in the small intestine and in that small intestine. So I'm going to show you, I'm going to bring up my lovely pictures. The one I love, the digestive system. So here it is again, and I use this often. If this is your first time joining me, I like to put up pictures just to help people understand what I'm talking about. We all understand better when we see things. So here is a digestive system. system. Sibo is small intestine. So unfortunately, when I move my cursor, you cannot really see it, but you can see here where it says the small intestine. I'm going to make this large. So here's the small intestine, and then the colon or the large intestine is that big thing that looks like a big braid going up, across, and then below. So the majority of the microbes in your gut are going to be in your large intestine. Now, there is the large intestine and the small intestine are connected together by something called the ileocecal valve. You don't really need to know the name of that, but that's how the small intestine connects to the large intestine. For a variety of reasons, some of it is central nervous system, some of it is structural, some of it is the wrong pathogen in the colon. They migrate, they move to the small intestine, where there should not be as many bacteria or microbes. So it's not necessarily that you have bad pathogen, although it might be the case. It's actually that you have the bacteria in the wrong place. The small intestine should have a very small number of bacteria. The majority is in the large intestine. When they migrate, that's a problem. And so that's something like really to keep in mind. The main job for the small intestine is to actually digest nutrients. So the final steps of digestion are going to happen in the small intestine, and also absorb the nutrients that you just digested. So I have a question here. Is abdominal noise okay? I notice it a lot. Oops, where did the comment go? Especially when slightly reclined, no pain. Yeah, it could actually. Abdominal noise is, well, the abdominal noise can actually be the noise of the muscles of the intestine actually moving. So your intestine is, and your digestive system is a one big, like think of it as a smooth muscle, and that's moving kind of like a snake motion. And so that movement can be part of the natural muscle movement. Now the noises can be related to gas. So if that's something, now when you're slightly reclined, I wonder if that is causing some heartburn or any acid reflux as well too. You know, if it's something that just happened, it's mild, it doesn't bother you that much, then it's maybe okay. It's something to monitor and see if it gets worse. But if it's something that starts to cause pain and becomes more frequent, then yeah, maybe it's something that you want to pay attention to and look at, like what else is happening and maybe what are the sources of that pain. So, because the pain can be from fermentation, which I'm going to be actually, if you continue to listen, I may answer your question about that pain in just a little bit. Hi Sharon, thank you for joining. Thanks everyone for being here. So if you're here, just say hi, hello, wave. If you just joined, I am talking about small intestinal bacterial overgrowth, or SIBO, in here. So we just talked about the symptoms: stomach pain, bloating, burping, belching, food sits in your stomach, you cannot digest it, you feel like really full even after a small amount of food, and it can also lead to food sensitivities, symptoms, fatigue, nausea, vomiting, as well to heartburn and acid reflux. So what is happening here is that, this bacteria, instead of it being in the large intestine, they are moving to the small intestine where they shouldn't be there. And then when they go to the small intestine, first of all, they're gonna start to compete with us for food. So they're going to start competing for nutrients like iron and B vitamins, and especially B12. So you might start to have deficiencies in these nutrients. If these bacteria in the small intestine, they're going to ferment. Fermenting is really digesting and breaking down the carbohydrates and the fibers in your food. In the perfect world, you are going to digest the digestible food items like the starch, the sugars, the protein, the fats. You're going to digest those because your cells of the intestine are going to produce the enzymes to do that, and then you're going to absorb them. And then only after the fiber and the material that is not that we don't have the enzymes for it, pretty much fiber, goes to the colon, that's when bacteria start to ferment it and give us all the health benefits of fiber. Now, when the bacteria is in the small intestine, now they're competing, and if we don't have the right enough enzymes, which is one of things that happen along with Sibo, then these bacteria are going to be faster and more efficient than us in fermenting the food. And so the byproduct of fermentation is going to be gases. Your body and your gut is going to accumulate gases, and these gases are going to push against the intestinal wall, and that's going to push against your stomach. So you will feel bloated. You may pass gas, or maybe your gas is stuck and you can't really pass it, which is even more painful than passing gas. You may feel belching or burping because the gas is going to go up to the stomach and the esophagus. And one thing is, you may think, like, what is the connection between the intestine and the esophagus and the belching is 30 grams of carbohydrates. So that's the amount of carbohydrates in maybe like a large apple or whole banana, or maybe like half a cup of rice or beans. That's enough to produce 10 liters of gas. So that's about 3 gallons of gas. So 3 gallons of gas. Imagine a milk gallon and 3 of it of gas in your stomach. So that's going to cause these symptoms. So this is going to cause inflammation in the gut. So first you have the pain, then you're not able to they're going to compete with nutrients such as iron and B vitamins. They are going to affect the absorption of fat-soluble vitamins. So the fat-soluble vitamins, things like vitamin A, vitamin D, vitamin E, these are antioxidants, very important. Vitamin D important for for immune system and deficiencies often in people with autoimmune conditions. So antioxidants, many of them dissolve in fat. So now you're starting to have fat absorption issues. The bacteria, when they grow, they're not supposed to be there, then they damage the gut further, which means that the cells that line your intestine cannot produce enzymes to finalize digestion. When they don't produce enzymes to finalize digestion, then the bacteria is even more efficient and better than you at digesting food, so they will ferment more foods. So as you see, it's like a cycle, like they're making the efficiency of your gut even worse. Now, the bacteria themselves can actually migrate into the bloodstream. So this gut, and we talked about leaky gut so many times, so the lining of your intestine should be really tight. And now when you have inflammation, when you have scarring, bacteria in the wrong place, and if you have leaky gut, then now this bacteria can enter the bloodstream and cause toxicity, and we call this endotoxins. So now that and there's one study that I shared a few weeks ago about how bacteria can pass through a leaky gut and cause autoimmune conditions. And also the bacteria, their byproducts and their toxins can cause neurological effects. So you may feel brain fog or migraines and headaches and other cognitive issues. So why should you care? Maybe you're okay with passing gas. That's fine. That's embarrassing. But when you think of all of your digestive system, how you're starting to lose nutrients, how this may cause joint pain and muscle pain and lack of energy and headaches and migraines, and how are they affecting your life? And maybe your digestive symptoms are really severe. So a lot of the patients that I work with, they have diarrhea. They have to always look for a bathroom wherever they go. They cannot go to so many places anymore, especially outdoors. Some of them have a hard time getting their commute from home to work because they have to get on a train or a bus, and they don't know when diarrhea is going to hit. Sibo can also lead to constipation. So if you have a certain overgrowth of bacteria that produces different types of gases, then you have constipation. You feel yucky, things are stuck inside of you, you're not getting rid of the waste, so your body's building toxins more, and it just doesn't feel good. Like it's overall, when you're just kind of backed up, not a good feeling. So it can lead to many issues and in long term. And so when we start thinking of autoimmune conditions and all of how it's affecting your life, what I want to ask, for those of you who are watching, if you have symptoms like this, what would you do if you did not have digestive issues, or if you did not have fatigue, or if you did not have stomach pain, or if you didn't have any of these things, what would you be able to do with your life or with your days? Or, how would you spend your time with people that you care about and your loved ones if you did not have these issues? If these issues were gone, how would that affect the quality of your life? I would love to hear that from you. And whether it's you or it's someone that it doesn't have to be yourself. I know Facebook is really very public, so I know some may not want to share, but you can always text that to me separately or email that to me separately. So these are the things that, okay, now we talked about why it's important, the symptoms. Now, what do we do to fix Sibo? Now, the thing is, Sibo is not easily fixable, unfortunately. There are some options out there. How do you know that you have it? We talked about the symptoms. For those of you in the US, there are some companies that do testing for Sibo. It's typically a breath test. So it's not a stool, it's not blood, it's a breath test that you would blow in the tool or the device, and they measure the gases that are being produced, and there's a whole way to interpret the test. It's important how you interpret the test. A few years ago, I attended a an actual session with Dr. Gerard Mullins. He is one of the gastroenterologists in Johns Hopkins Hospital. And back then, a lot of my patients were getting tested, they were negative, but their gastroenterologists were still putting them on antibiotics for Sibo. And I asked him, like, why is this happening? And his answer a few years ago was that the testing is not accurate, there are a lot of false negatives, and we do the best that we can, and so based on the symptoms that he puts his patients on the medications. So just keeping in mind that tests have improved a lot since then, but there's always the potential for a false negative to happen, or a false positive. So like interpreting it is also important. It's not looking at the whole person and the symptoms as well. So someone said, I'll be more happy and outgoing if I didn't have those symptoms. I understand, absolutely. And it does affect your life when you're just not feeling good, and you compromise. You do what you have to do, like your job or your errands, or like caring for your kids. You might do that, but then the things that you love and enjoy, then you're going to make that sacrifice and give them up because you're tired and you just cannot keep up. And so thank you for sharing. A full blood count test for a parasite, no, it does not. It may tell that your white blood cells are elevated, which are the cells that are going to fight pathogens. So that's a sign for your doctor that there's something that's causing the immune cells to react, but it doesn't really diagnose or detect parasites themselves. So what are we going to do? So I'm going to go back to Sibo here, and Sibo, the tests are more accurate, and it's actually have to interpret them from a holistic way, like looking at the symptoms and also the risk factors, like is that person who is likely to have Sibo. People who are likely to have Sibo, if you have been on a PPI or acid reducing medication, I feel so sorry to tell you this. I keep talking about those medications so many times, but these medications are going to suppress the acid in your stomach, and the stomach is what's supposed to be sterile and prevent microbes and bacteria from growing. Now it's not. So people who are on PPIs tend to develop Sibo. H. pylori can be related to Sibo. If you have pathogens growing in the large intestine, so Sibo is not necessarily that you have bad bugs, it's that you have bugs in the wrong place. But what makes the bad bugs or the bacteria migrate in the wrong place? Potentially an overgrowth of parasite, virus, or bacteria in the large intestine. Sometimes it's a motility issue. So motility meaning how quickly the muscles of your intestine actually push food. It can be neurological related. It can be condition called gastroparesis, or any other nerve issue that is causing that signal to get messed up. I was talking to a chiropractor yesterday, and with adjustments for the nervous system, because the nerve and the gut connect and they talk, so something in the nervous system the signal may not be going properly. Eating too frequently can cause Sibo because the body does not go through that cleaning motion that gets interrupted when you eat. Some other things that are related to Sibo, I had one, if I remember, I will mention it as well. So as you see, the wrong medications can, and I talk about this also in the context with my acid reflux book. You know, I've been doing a lot of research on that as well too. Yeah. So there was one thing I can't think of it. The thought is gone, so it will come up. What do we do to solve SIBO? If you get SIBO tested, at least here in the U.S. with a gastroenterologist, my guess is also other places in the world, the physicians, typically their way for solving it is an antibiotic. There are a few antibiotics. Xivaxan or rifaximin is the one that is typically prescribed for SIBO. Now, I am a dietitian. I don't have access to medications, and I'm biased because I believe in food and lifestyle and botanicals, so that's what I use. Some people use medicines with success, so that's, you know, my purpose here is just to educate you and give you the options and what is available and what's possible. With the medications, many times I've seen patients, they're on the medication for 10 days, for 14 days, they feel good, but because it's not a holistic approach, a month later or 2 weeks later, the symptoms come back, and that's when they see me and they want to solve it differently. So that's one thing that I just caution you to be careful about. Other things that I have used successfully is diet and botanicals. So diet meaning eliminating certain foods that promote fermentation. So things like garlic, onion, beans, actually all grains can be a problem. Honey, foods that have fructose in them. So some of those are actually healthy foods, but we want to eliminate them for a short period of time. Sweeteners, mainly starches, carbohydrates, because they feed the bacteria. So we don't want to feed the bacteria, we want to starve it. And then also in combination with the use of botanicals. These are things like garlic, oil of garlic, and a few others that I use, oil of oregano, in my practice for a few weeks to help naturally kill the bacteria. The advantage of doing something like this is that, first of all, they're natural, and then that they are not as harsh on your system, so the effect is slower and it's longer. It's longer, but it's easier for your body to adjust. And I've been able to see long-term success with that with my patients, along with the diet. And then we start to introduce some of the foods that we took out and see how their body tolerates. And oftentimes we redo the testing to make sure that SIBO is gone or the numbers are improved. Another thing, if that does not work, there's something called elemental diet. If that's something that you think you have and you're still not getting any results or improvements, I can talk about elemental diets at a different time, but pretty much it is, the food is broken down to basic sugars and amino acids and fats, so the gut pretty much shuts down, does not work. You completely starve your gut, but you also you don't let your gut work, so that could lead to some other side effects. So I don't use it unless it's really a last minute resort. So I had someone ask a question here. Thank you for joining me. Do you recommend gluten-free diet? Gluten-free diet removing gluten is one of the steps for SIBO, because gluten is found in wheat, and wheat is highly fermentable and it's a carbohydrate. The bacteria loves that, the fibers in that. And so yes, the diets that I use typically eliminate gluten, and that could be one thing that you can start with. But if that helped, it does not mean you stop there, because if you really want to get to the underlying root causes and knowing that what SIBO can lead to. And especially if you just joined, you can watch the beginning of that episode, the nutrient deficiencies and triggering other inflammation in the gut. I do highly recommend that you don't just stop at gluten-free, that you investigate why is this happening, what are the root causes. Now, another quick thing is, because of the gut motility, or like the gut being slow can lead to having SIBO, it's important to think of ways to make sure that your digestion is working properly. So that may include naturally ginger, and ginger promotes digestion. Having digestive enzymes, whether if you can tolerate raw apple cider vinegar, or there are digestive enzymes on the market that I use. Removing any medications, the acid suppressing medications. Talk to your doctor. So don't get me in trouble, don't get yourself in trouble. Talk to your doctor about that. Maybe considering acupuncture or chiropractic, that could work. And definitely addressing it with the right diet, with the right foods. Timing of meals are important, and antimicrobials from natural botanicals. There are multiple products on the market. I use few protocols. Sometimes I use one and then see how the patient is doing, and then go another month on a different protocol, because it can be stubborn, unfortunately, and really looking at the root causes. Why is this happening? So that was pretty much the quick summary of SIBO, what it is. Know that SIBO, because of all this fermentation, it can push the content of your stomach up, and that can cause acid reflux and heartburn, which is something that I've been investigating and researching for my book in the past few months. And so I really wanted to bring this forward and share this topic with you. If you are watching this, if you have other questions, make sure that you write them in the comments. If this was useful, if you thought this was helpful, and you have a family or a friend who has irritable bowel syndrome, or maybe has not been diagnosed but has bloating, diarrhea, gas, belching, stomach pain, indigestion, nausea, vomiting, fatigue, headaches, because the gut is really connected to many systems of your body. It is the foundation of health. When SIBO happens and things get messed up, it will affect so many parts of your body. If you or a loved one have this, share it, tag them on this post, and I'm happy to answer any of your questions. So that was it for today. This was Noor Zibde, functional dietitian and nutritionist, helping people with digestive issues and healing their guts. And that was Thank Gut It's Fixed Joe. Thank you for joining me, and I would love to hear your comments and questions. See you next time. Bye.